Hello, so today I'm going to go over my case study for non-surgical periodontal therapy. All right, my presentation components will go over medical history, assessments and treatment plan, radiographs and photos, the treatment I provided, oral hygiene instruction, reevaluation findings and suggestions, post-treatment therapy, and my reflections. So the medical history for Nathan is that his last dental exam and cleaning was over 5 years ago. So it had been a long time due to his dental anxiety and also because he had been trying to get his heart condition under control and officially diagnosed. So oral health just wasn't a priority to him before he had come in. However, he said he had a wake-up call when he had to have a tooth extracted because of a cavity and also because he had been having some sensitivity and gum pain on the front of his maxilla. He's an ASA2, and he said that he has snacks daily high in sugar, and he also drinks coffee with creamer every day. So at his initial appointment in November, we did periodontal assessments, and the probing depths were not too deep. There were 5 areas of probing depths above 3 millimeters, but nothing went above 4 millimeters. And he had 13 points of bleeding during probing, as well as a high risk of the microscope sample. And he had severe inflammation as well as a furcation. The small irritation on his palate, he said he thinks was from eating chips a few days ago. And then this is his perio risk assessment from the Philips Care Tools website, where it shows that he's a high risk for periodontitis, and it shows suggestions for treatment and recommendations. This is his complete mouth series that I took on him last year, where you can see, especially in the maxilla, there's interproximal caries on his right side as well as between the 2 front teeth. And you can see some bone loss here. In the bite wings, these are vertical bite wings. You can see the bone loss a bit easier. And also you can see the close-up of those interproximal caries. So he has generalized 20% horizontal bone loss, and you can also see high levels of subgingival calculus. And then these are the photos before treatment. You can see the shadows of his caries, the heavy calculus deposits on his mandible, and in all the photos, but especially the bottom right, you can see the severe inflammation in his gums. So this is his treatment plan showing he's high risk for periodontitis, also high risk for caries. And so he agreed to come in for 4 appointments so that we could do scaling by quad, as well as a fluoride treatment at the end. Again, his risk assessments were high, and the dental hygiene diagnosis was generalized periodontitis stage 2, grade B, and that is also his consent form there. For the initial appointment, we went over oral hygiene a lot so that he could get a good base and get things started with healing really well and get started on his goals for better home care. He had a consistent schedule of brushing 2 times a day with fluoride toothpaste. He said he used a water pick every day and mouthwash. And so we went over, I showed him the photos of his calculus buildup. We talked about his risk factors. And for home care, we talked about using string floss in addition to the water pick, since the way he was using the water pick and toothbrushing were not sufficient for him at this time. And also I sent him home with an interdental brush for the space left from his extraction. We talked about nutrition a little bit as well, about how the carbs and sodium were not good for his heart, and he agreed to cut back on those and find replacements for those. Also, we talked about the sugar and his snacks and creamer, of how those can affect the caries and also the periodontitis. So for his first treatment day, I did the lower right quad with local anesthesia and nitrous oxide since he had dental anxiety. We also went over OHI again. That day I demonstrated sulcular brushing again and talked about reaching the back molar areas. I noticed that local anesthesia wore off quickly on him So a couple areas need to be re-anesthetized so that he was more comfortable. And also because of the heart condition, we limited to a maximum of 2 cartridges per appointment. His next appointment, I did the lower right quad. The previous area wasn't showing much improvement yet as far as healing. The plaque was less, though, significantly. The tissue response, again, wasn't much different yet. The inflammation had gone down, though, from severe to moderate. So I did the lower left quad that day and number 15 since he was my sub-calculus competency. And again, anesthesia and nitrous oxide. And this time for OHI, I demonstrated C-shaped flossing and reminded him to do it every day, especially in his lower anteriors, because that's where most of the plaque accumulation seemed to be. His next appointment, I did the upper right quad. The previous areas still had moderate inflammation and slight interproximal plaque. So I went over flossing again with him and also gave him the smaller interproximal brushes and showed him how to use those to use them most effectively. And then his final scaling appointment, the inflammation was still moderate and interproximal plaque was moderate. I scaled the upper left this time, did a pre-polish, and also gave him a fluoride varnish. So we went over oral hygiene thoroughly again, demonstrating sulcular brushing, how to use the interdental brushes, how to do the C-shape with the flossing so that he could be more efficient with those. And so at his reevaluation in May, the tissue condition had improved. He was now at a B at risk for periodontitis, down from a risk factor C. The inflammation had gone down from severe to moderate. The bleeding points went down from 13 to 6, and the probing depth above 3 millimeters went down from 5 to 3, which was really exciting. So definitely improvement. His post-treatment photos are here where we can see that the calculus is removed and plaque is reduced. He was getting better at plaque removal at this point. You can see the reduced inflammation as well. And with disclosing solution, this is while we were going through OHI really thoroughly, you can see that there is still heavy plaque buildup interproximally and on the molar area. So after the disclosing solution, I had him practice in the mirror with removing those areas and told him to notice how it feels to get back there so that he could remember a little easier of how to get those areas that he needs to. And then again, here's the oral hygiene instructions we talked about at the reevaluation, going through everything thoroughly. He said that he had improved his diet significantly. He reduced sodium intake, increased vegetable portion, and cut down on his sugary snacks as well. For post-treatment, the dentist recommended a lot of restorations, 21 surfaces. 16 of those I completed before the reevaluation appointment, and he's currently on the wait list for the remaining surfaces, as well as for root caries that were the cause of his gum pain. And he agreed to continue regular care and come in every 4 months for periodontal maintenance appointments. So I selected Nathan as my patient because he stated that he had a wake-up call and really wanted to start taking better care of himself. So I thought there was a lot of potential for his prognosis and for healing. He was extremely motivated, especially after starting to see the changes, and also after seeing changes from his diet. He said he lost a significant number of pounds. He bought a blood pressure cuff for himself and was taking his blood pressure daily and said that it had been consistently in the healthy range for over a week at the time of the reappointment. And he actually texted me yesterday saying that my blood pressure was 118 over 79 today. It's still really low. And so he's really excited about keeping oral health a priority and noticing how it affects the rest of his health too. The prognosis then for his dentition is good. Tissue to show signs of healing well, home care and diet have improved, and his blood pressure has improved. The restorations made a big difference, I think, and I'm hoping he can get his other restorations soon so that the prognosis for those teeth also can continue to improve. So one thing I would have done different, looking back, is that because of his high caries risk and also the current caries, I think it would have been really beneficial for him to have chlorhexidine rinse as well as prescription strength fluoride toothpaste like Prevident Plus. And so if I do see him again for an appointment, I would probably prescribe those. And my greatest learning moment was, I don't know if there's one specific moment, but just kind of overall seeing how quickly the tissues were able to heal and how much his motivation made such a difference in his improvement with pocket depths, inflammation, and lifestyle and home care as well. He still needs improvement on the plaque control, but he's very motivated and he's using all the tools and he's just working on his skills at doing the proper techniques in order to keep his teeth clean. So thank you very much.